Good evening. Welcome to the broadcast. My name is Purity Musel and Lucy Mwara is our sign language interpreter tonight. We ask you, will you take the jab, the COVID-19 vaccine jab, if and when the time comes? At Purity_Musel and at KBC Channel 1 News. The hashtag is Channel 1 Weekend. I'll be going through your views and feedback during this broadcast. Let's begin this broadcast. Acting Director General in the Ministry of Health, Dr. Patrick Amoth, is the first person to get the Oxford AstraZeneca COVID-19 vaccine jab on Kenyan soil. Dr. Amoth took the AstraZeneca vaccine at the Kenyatta National Hospital in Nairobi as the Ministry of Health officially launched the countrywide vaccination campaign. The DG, who spoke shortly after the vaccination, said or assured Kenyans of the safety of the vaccine and urged those who will get the opportunity to take the jab not to hesitate. The health workers rather will be the first beneficiaries of the exercise. A calm and collected Dr. Patrick Amoth, Kenya's Health Director General, rolled up his sleeves to lead the nation in getting the Oxford AstraZeneca COVID-19 vaccine jab. Kenyatta National Hospital's CEO, Dr. Evanson Kamuri, was second to receive the jab on the Kenyan soil, followed by a nurse at the hospital and Dr. Collins Tabu, the head of immunization and vaccine program in the health ministry.
I'm feeling great. That is why I can be able to stand in front of you in this hot sun and address you. So that is an indication that the vaccine is safe.
The exercise began with a brief conversation between the nurse in charge and the person receiving the jab, probably an update on possible side effects of the vaccine, after which one is inoculated.
I was being briefed about the potential side effects of the vaccine, like I would be able to get some headache, some pain in the body, heaviness in the arm. These are standard potential adverse events of the vaccine. They may not happen to everybody, but it's important to be aware of them so that when they happen, you know the reason they're happening.
Oh, she was informing me about a few minor effects, like probably pain, a bit of, and things like that, which really wasn't there. And just in case there are any serious adverse effects, what to do. But so far, so good.
The dose will protect those who have received it from adverse effects of the deadly COVID-19 disease for at least 8 weeks in case of an infection before the second dose is administered. All those to be vaccinated have to sign a consent note and after the vaccination, rest for 30 minutes before being discharged. The World Health Organization country representative, Dr. Rudy Eggers, termed the vaccine a game changer in the fight against the deadly COVID-19 disease in Kenya.
The AstraZeneca vaccine produced by the Serum Institute of India, this vaccine we now have in Kenya, has been reviewed and found safe by WHO itself and several other stringent regulatory authorities, including the United States FDA and the European Regulatory Authority.
According to the Ministry of Health, the exercise will kick off in other counties on Monday next week.
The Ministry of Health is employing a data management and reporting electronic vaccine registry, the Chanjo Management Information System, which was developed together with our experts from the Ministry of ICT and Youth Affairs. The system will enable the Ministry of Health in vaccine traceability, thus ensuring that our stocks are professionally managed. It will track and manage vaccination schedules. It will help in the routine, the reporting and addressing of any adverse effects, and it will finally provide us with the reliable reports that we require for decision making and for policy.
North Rift region has already received a consignment of 60,000 doses of COVID-19 vaccine set to benefit Baringo, Nandi, Uasin Gishu, West Pokot, Turkana and Trans Nzoia counties. On Thursday, President Uhuru Kenyatta flagged off trucks carrying the doses to be distributed in health facilities across the country. The vaccine was procured by UNICEF under the COVAX facility. There's light at the end of the tunnel. The fight against the COVID-19 disease has been boosted by the arrival of the Oxford AstraZeneca vaccine. However, experts warn that we are yet at the exit of this tunnel and Kenyans need to strictly continue to adhere to COVID-19 protocols. Purity Museo, Channel 1 News at the Kenyatta National Hospital, Nairobi.